Hello, this is Rebecca with Lake Road Animal Hospital, bringing you an update from the Lake Road Animal Hospital doctors and all of the team. We wanted to take this opportunity to share an update on what's going on inside of Lake Road Animal Hospital as the summer of 2021 draws to an unofficial close with Labor Day this weekend. First, we wanted to thank you for choosing to share your pets with us at Lake Road Animal Hospital. The team is deeply appreciative of your choice and understands the level of trust that you have instilled in your choice for veterinary care. Our goal remains to create a strong partnership with you and to ensure that your beloved fur kids remain healthy and happy and with you for as long as possible. Many of you have likely noticed that there has been difficulty accessing appointment times of your exact choice of day and time since this past year. Please understand that our area is experiencing a couple of issues that have created this concern for all of our clients seeking care. First, as many major news outlets have reported, there are more pet owners than ever before. In addition, with people working from home in the past year, pets with more subtle signs of illness were noticed having an issue and veterinary care has been requested. At the start of the pandemic, veterinary practices were ordered to see only sick patients and to cease all preventative care to reduce the volume of people that would need veterinary care and to save on medical equipment, PPE, and the medications that are also used in human health care. That created a backlog in preventative care that many practices are still trying to catch up on today. These issues created a significant surge in demand for veterinary care. The second issue contributing to the concerns of accessing care is the loss of veterinary professionals from the field. Just in the Corning and Elmira area, we have experienced a net loss of veterinarians over the past couple years that has created significant issues for our neighbors to manage their existing patient numbers. At the end of the day, there is always a limit to the number of patients a single doctor can care for on any given day, and that number varies by the degree of supervision required by those patients. Nationally, it has been estimated that we are short between 3,000 and 5,000 veterinarians. It is expected that those numbers will increase a good deal in solution and begin to affect change. Further, the need for veterinary technicians is even stronger, with more veterinary technicians leaving the field than veterinarians. Why are we experiencing the shortage of veterinary professionals? The reasons are many, including financial. Income is low in this field, with the 2019 national starting salary for a small animal general practitioner of $70,000, according to the American Veterinary Medical Association. The average new veterinary school graduate leaves school with over $149,000 in student loans. Again, from the AVMA. Doctors graduating from Cornell University are likely to have significantly higher debt loads. Add the New York State cost of living, and New York State does not become an attractive place for a new veterinarian to seek employment. In addition, many people who work in veterinary medicine are people who have been previously scarred by the world and seek solace by working with animals. The surge in demand, coupled with the rage that so many have been feeling since the pandemic began, that has spilled out in frustration with changes to the way we do everything, has led many veterinary people just to walk away from the field. The field has always been emotionally difficult. Their companion animals do not live for as long as we do. It's very rare to have a single day in a veterinary practice that we don't assist a pet in crossing the Rainbow Bridge. The team carries your losses in their hearts, and those pets that we have come to know so well are especially difficult on us. We just passed the 1-year mark of the passing of our beloved Lake Road patient, Stanley, and we talked about him a great deal last week. We don't forget and move on. We also need to process our feelings for your losses. And while it's a great toll, it's also a great burden of love. Despite the fact that we have not lost any doctors, Lake Road Animal Hospital began advertising for a veterinarian in October 2020 with extremely limited interest. We began advertising as we noted enough of a consistent increase in demand to warrant adding a doctor to our team. We just created a recruitment video in the hopes of being able to show doctors and technicians seeking employment what it's really like to work at Lake Road Animal Hospital and to attract someone who will fit our practice and its culture. Most of the practices in our areas are also advertising for doctors, and some have been advertising for much longer than Lake Road. However, I do want to warn you that you may well experience some difficulty accessing care at the date and time of your choice in the upcoming months. Dr. Mulligan will be going out late in October to welcome and bond with her new baby. She will be out of the practice for a period of about 12 weeks. During this time, Dr. Hughes has graciously offered to increase back to her full-time hours after working part-time for several years. In addition, Dr. Wilcox will be hopefully adding another half day on a consistent basis, as well as a surgical day per month. There will be some changes in dates when we offer surgery to accommodate the doctors and their skill sets. If you need a very specific date for your preventative care appointment, please plan to call and schedule that sooner than later. We would recommend scheduling about 6 weeks in advance. Dr. Brenham's availability for office visit consultation may be impacted as well, as he may need to increase the time that he spends in surgery. Another update we wanted to share was with regard to pricing and the availability of products. As many of you with pets on prescription diets already know, sourcing some pet diets has become extremely difficult. The pet food companies are dealing with the same lack of staff that many of us are seeing in our workplaces. In addition, they're dependent on shipping carriers. With so much product now being shipped, there have been significant delays. My best advice is to have you order your pet's food directly from the manufacturer on platforms like Hills to Home, ProPlan, Vet Direct, or Vet's First Choice, or from a large distribution source like Chewy. Whichever you choose, set up AutoShip to have your food shipped automatically in whatever the frequency is that you need. Payments are going to be honored before the more random food orders. In addition, a large distributor like Chewy can order and store a huge amount of product from the manufacturer. When we place an order for Hills diets, we rarely reach a 75-pound total. Lake Road Animal Hospital is less than small potatoes to these manufacturers, and we are often unable to source the product that Chewy may have in stock. Pet diets are not the only products that we have difficulty sourcing. Many of the drugs and supplies we utilize have been up and down in availability and price for the last 18 months. Erin, our veterinary nurse and inventory manager, keeps close watch on our inventory and stays in close contact with our distributors to know when we need to order ahead in an effort to keep us from running out of things. Know that we only increase prices when we find that our price to acquire a product has also increased. And like everyone else, prices we pay for support and ancillary services have increased. Utilities, merchant processing fees on credit card payments, reference lab services have all increased. In addition, we do want to keep our team intact and avoid turnover, so we are committed to ensuring that our team members are fairly compensated and they are not looking for jobs that will pay better and provide an environment with less life and death. Flipping burgers is less stress than veterinary medicine, and if it pays more, what incentive is there to stay here? Lake Road Animal Hospital relies heavily on the skills and the talents of our support team, and we feel that it's important that our team is compensated for that level of responsibility. We also believe that a stable team allows us to work as efficiently as possible and able to provide the same level of service to all of our clients that you have come to know and expect from Lake Road Animal Hospital. And finally, we wanted to touch on curbside care, the vaccine-proof requirements, and the face masks. A single fully vaccinated adult with proof of vaccine may enter the building with their pet for a doctor visit. Masks are required for all clients and our team while working in exam rooms. Our team is very nearly fully vaccinated, and those who are not yet vaccinated are required to wear masks at all times and self-monitor for symptoms. Lake Road Animal Hospital has rapid COVID tests on site should any one of our team members begin to feel ill. We are very well aware that should any of us fall ill, the likelihood of others falling ill is high, despite our high rate of vaccination. We work in very close proximity with each other, and passing an illness is extremely easy. We are limiting the number of clients entering the practice in an effort to limit possible exposure. If you have an appointment with one of our doctors, are fully vaccinated but are not feeling well, we do ask that you remain in your car for your pet's visit with us. We know being curbside is often a less desirable option for care, but if our team becomes ill, we would be forced to reduce our capacity or to even close our doors. And that would not be beneficial to any of our patients. And this is why we are so vigilant about who is being granted access to face-to-face interaction with the team. To illustrate our commitment to keeping our team healthy, we paid our team for the time that they needed to be off to get their vaccines, as well as the day after to recover if they experienced any side effects. In addition, we bring a pharmacist from Rite Aid each fall to provide influenza vaccines for our team. The team values self-care and are all vigilant about reducing their exposure outside of work. If we are not healthy, we cannot serve you or your pets. It's really that simple. Thank you again for the honor of caring for your patients, and we look forward to seeing you soon. Please don't hesitate to reach out with any questions, concerns, or comments. Thank you.